I'm Dr. Gaurov Dayal, the Chief Medical Officer at Adventist Health Care and a pediatrician. Here's some tips to stay healthy this flu season. 3 very important things. The first is get your flu vaccine. It's available right now, and it's the only proven method to prevent the flu. Second of all, hand washing all the time throughout the flu season, and otherwise as well, but definitely during the flu season. The flu is spread to people by contact, so if you're outside and there's people with the flu, you're going to transmit it to each other by your hands. So you have to wash your hands pretty much rigorously all day, definitely before eating. Avoid touching your eyes, your ears, and your nose, because that's again how the flu is transmitted. And finally, limiting exposure to other people with the flu. So if you have the flu, don't go outside, don't go to work, don't send your children to school if they have the flu, because they're going to spread it to other people. And likewise, if you know somebody who has the flu, avoid them until their symptoms have resolved. The symptoms can be very different in different people, and that's why often it's tricky to diagnose the flu. One thing is that it's very important is fever. So if you're having a fever over 101.5, with cough and cold symptoms, that's a good indicator. In the elderly with chronic medical conditions, things like fast breathing, lethargy, those are often seen. In children, often you'll see gastrointestinal symptoms such as diarrhea, vomiting, stomach pains. Again, there's not one thing that can predict that you have the flu, but it's usually cough, cold, runny nose, plus fever, and lethargy often goes hand in hand with having the flu as well. If you have any serious symptoms like we just talked about, then it's wise to immediately contact your doctor or go to the local emergency room. If your symptoms are mild, however, it's definitely worth calling your doctor's office first, because this is a self-resolving illness. There's really no treatment for it, and you're better off not going outside of your home if your symptoms are mild. There's 2 reasons for that. The first is that if you have the flu, the last thing you want to do is to go outside and spread it to other people in a waiting room or in a shopping mall or in a clinic. And second of all, if you don't have the flu, if you end up going to a doctor's office or an emergency room where people have the flu, you're at a higher risk of getting it from there. So if your symptoms are mild, call your doctor's office, run it by them, but in a vast majority of cases of the mild flu, you don't really need to do anything beyond rest and hydration. If your symptoms are worsening, or if you have children, if their symptoms are worsening, of course, err on the side of caution and contact your doctor's office immediately. H1N1 emerged as a global health threat last year. This year, the expectations are that it will impact several thousands, if not millions, of people. Well, it's yet to be seen what the impact is. Keep in mind, however, that the H1N1 vaccine will not prevent the seasonal flu, and the seasonal flu vaccine will not prevent the H1N1. So while we're awaiting further recommendations around the H1N1 guideline, I highly recommend that people get vaccinated for the seasonal flu, and also let's make sure that we're doing common sense things to prevent spread of both types of these flus. And the most important things are, is number 1, to get your seasonal flu vaccine, number 2, frequent hand washing, or use of hand sanitizer. And finally, if you have the flu, stay at home, don't spread it to other people, and if you know people who have the flu, stay away from them until they recover.